Good evening to everyone and welcome to today's session. Past few days, I could not spend much time with you guys. Almost 45 days before which we were intensely interacting every day. But now the time has come. It is October 16th. We still have 75 days of time. 75 days is a wonderful period for both the teacher and the student to study every day, work together, get inspired to prepare and crack the exam in the January first week. So let's make the great beginning. Every day at evening 6 p.m., just like earlier wonderful days, we will have a discussion of 50 to 60 questions every day. And also, don't forget to download the Incus quiz app. Across the day, the morning 8 a.m. to night 12:30 p.m., you have every hourly a quiz tournament that you can compete with all your friends and play the quiz tournament and shine your preparation, right? So let's make the great beginning. So, yes. Let us start with radiology. Radiology is always interesting, primarily because there is something to see in the format of an image. There is something to interpret. And it is more quizzical in nature, the radiology. So, double bubble sign, where do we see? So let us pick up the PGI question bank of the last 15 years and then try to master it with the daily revision. So double bubble sign is a feature in duodenal atresia, duodenal stenosis, also in volvulus. We see double bubble sign. Good to see Anusha Lakshmi, excellent. You can inform your classmates to join the live session every day evening at 6 p.m. with Dr. Murali Bharadwaz until the NEET PG 2021. So this is how the double bubble sign you can see. One is the gas in the stomach and other is the gas in the duodenum. So typically the double bubble sign. Miliary mottling. Classically, online students can punch whether the voice is loud and clear for everybody. Can you please punch whether the voice is loud and clear? Miliary mottling, where do we see? We all know we see it in case of tuberculosis. Also, we should know we see it in sarcoidosis. So this is how millet seed is shaped, sized. Opacity makes it a miliary mottling is what you need to remember. A patient presented with a metallic foreign body in the eye. Always all metals are a contraindication for doing the MRI, as all of you know very well. Whenever there is a spondylolisthesis, when one vertebra slips over the other vertebra, what is the classical radiological sign? It's called B-headed. B-headed means the head is being cut. Scottish dog sign. There is also another important sign called Napoleon sign. So typically this is a Scottish dog. Scottish dog. So just like a Scottish dog's neck is being beheaded, you see it whenever there is a spondylolisthesis, where there is a slipping of one vertebra over that of the other, is what you need to remember. The heart has an apex. The heart is having a base. So what are the structures that form the base of the heart is a very, very important question. So both right atrium and left atrium typically form the base of the heart, as you all know very well. So this is one of the favorite questions in radiology. Left border, right border, base and apex of the heart. What constitutes them is a very important question. Now, with regard to magnetic resonance pancreatography, how do you do that? We use the MRI to obtain the images, and typically MRCP shows the biliary tree is what you need to basically remember. If you are using iridium 192, how much radiation? This is purely a numerical value. 0.47 is the value that you need to remember. So where do we see double bubble sign? So once more, one of the favorite, frequently asked, repeated question. Tomorrow's NEET PG also this will come. So dear, at least all of you know. Additionally, you should remember volvulus is something that you need to remember. What is the contrast? What is the contrast which you use in ultrasound? There's a list to remember. There is no other way than to remember that list. So sonovist is the one which is used in ultrasound. So what are the various contrasts? And the list that you need to remember is very important. Good to see 5 online classmates. Once upon a time on this forum, we used to have 300, 400. Last 1.5 months, I was not getting time. But from now, since the exam fever has started, for the next 75 days, every day we are going to have 1 to 2 hours of session. So please inform your friends to also join. So Livolist, Sonovist, Sonogen, Filmix, Omalex, Sonoview, they're all the intravenous contrasts that you can be able to use. Now, what is the most common cancer that you get because of the radiation? You need to remember, it is the leukemia, the most common cancer because of radiation, because bone marrow is highly vulnerable, as all of you know very well. Now, yes, one grade is equal to how many rats? This is one of the fundamental questions. If you look at the past 20 years of question papers, this is something that is often asked. So 1 grade is equal to 100 rats is what we need to remember. So you should know what are the various units of radiation. This is a very important question. One is exposure dose, radiation absorbed dose, equivalent dose, and effective dose. That's how you divide. Roentgen and coulombs per kg, they are about exposure dose. Roentgen is a conventional unit, SI unit is coulombs per kg. Radiation absorbed dose is called rad, which is conventional. which is conventional, and gray is the SI unit. REM is the conventional unit called equivalent dose, and sievert is the SI unit. Then once more, sievert is also the unit for effective dose. So you should know what is the definition of each of these various parameters of radiation and what does these units actually mean. Absorbed dose होता है energy per unit mass. The unit is gray. Equivalent dose होता है absorbed dose of X radiation weighting factor. If you use the weighting factor, that is sievert. Effective dose is sum of the equivalent dose to organs or the tissues expressed, each multiplied by the appropriate tissue weighting factor. That is sievert. Then equivalent dose integrated cumulatively over a period of 50 years. That is sievert. Committed equivalent dose. Similarly, the effective dose integrated over a period of 50 years, you call it as sievert. So these are the various absorbed dose, the various definitions of the radiation dosages. So otherwise, in simple words, the number of disintegrations per second is 1 becquerel, and 37 billion becquerel is equivalent to 1 curie. Similarly, the dose absorbed, one is radiation activity, other is absorbed dose, third is equivalent dose, which you need to be very sure about. So 1 joule per kg is 1 gray, and 1 gray is also equivalent to 100 rads, which is equivalent to 100,000 millirads. So you need to have a pen and paper to master all these facts. Then equivalent dose is gray into quality factors, that is sievert. 1 sievert is equal to 100 rem, which is equivalent to 100,000 millirem. So these are the points you need to understand with regard to the radiation units is what you need to understand. Now, what are the properties of helium? How do you like to describe helium? So the atomic number, hydrogen, helium, we all remember in our chemistry days, right? Viscosity of the helium is 0 and it is used in COPD. So they're all the true statements because COPD has a lot of resistance for the flow of the air. So because the viscosity is almost 0 for helium, you can use it in the conditions where there is a greater resistance for the flow of the gases along the respiratory tract. Now, what constitutes the right border and the left border of the heart is a very important question. So you should remember that superior vena cava, which is draining ultimately into right atrium, these two constitute the right border of the heart. So the right border has a straight upper vertical border and a smooth convex lower cardiac contour. This is because of the right atrium, and the straight part is because of the SVC is what you have to ultimately remember. Now, if you look at the right atrial enlargement. So when will right atrial enlargement occur? Anything which is a regurgitant or a stenotic lesion at the level of the tricuspid valve will lead to right atrial enlargement. Similarly, if there is any lot of pulmonary hypertension with a back pressure onto the right ventricle, that will have a back pressure on the right atrium. Whatever it is, the right atrial enlargement is identified. How do you identify? The right border which is lower part of the right border, which is due to right atrium, become more convex. Normally only it is convex, it becomes more convex and elongated. Similarly, if the right cardiac border from the lateral aspect of the thoracic vertebrae, if the distance is increased more than 2.5 centimeters, you consider it as right atrial enlargement. If the right border of the heart is more than 3.5 centimeters from the sternal right border, sternum's right border, then you call it as right atrial enlargement. And whenever right atrial enlargement is there, that leads to relatively more expansion of the right part of mediastinum than the left part from the midline. There are various ways to recognize. So you have the right atrium, you have the SVC that typically constitutes the right heart border is what you need to remember. Now look, the radiosensitizer, which is a radiosensitizer drug, misonidazole, actinomycin D, oxygen, hyperthermia, they're all considered to be the radiosensitizing factors. So एक लिस्ट होता है, जरा वो लिस्ट को बट्टी मारना है. Hyperbaric oxygen, carbogen, nicotinamide, metronidazole, hyperthermia, they're all called radiosensitizers, is what we need to remember. Now, what are radioprotective drugs? Once more, another list. Emifostin, you need to remember, is a radioprotective. Superoxide dismutase, selenium, they all will be free radical scavenging and cellular detoxification. Then keratinocyte growth factor also is known to be radioprotective in nature because of the repair. Ring enhancing lesion in the brain. एक ring enhancing lesion देखे तो आप जिंदगी तमाम याद रखेगा about it. So what is a ring enhancing lesion? Brain abscess, a resolving hematoma, or a primary CNS lymphoma. Any encephalopathy, infarction, anything can lead to development of this kind of a ring enhancing lesion is what you need to remember. With regard to the X-rays, X-rays are of low frequency and a long wavelength is what we need to, that is wrong. They have high frequency, they have a short wavelength, they have a dual character, they are penetrating, they are electrically neutral, is what you have to ultimately remember. Now, cerebral, actually, इसके पहले वाला क्वेश्चन का explanation है. Which is a cerebral ring enhancing lesion? Is there any mnemonic to remember? Yes, sir. Yes, sir. This is one important mnemonic which you need to remember. Magic doctor, metastasis, abscess, glioblastoma multiforme, any infarct in subacute phase, any contusion or demyelinating disease like multiple sclerosis, radiation necrosis, any of them can lead to development of a cerebral ring enhancing lesion is what you need to remember. So this is how a glioblastoma multiforme. This is a glioblastoma multiforme. Then this is a demyelinating lesion. This is also ring enhancing in nature is what you need to remember. Now, what is an advantage of MRI? In MRI, CSF is hypointense on T1 and hyperintense on T2, the cerebrospinal fluid. Vascular structures you can see better on MRI. If you want to differentiate benign from malignant pulmonary nodule, MRI is good. And MRI can be used in multiple planes. So that is the advantage of MRI. But if you want to see calcification, always the best to see the calcification with a CT scan is what you need to understand. Now, sickle cell anemia. What are all the features that you see? So, vertebra plana and floating teeth. So, they are the important things in sickle cell anemia. Crohn's disease, what is the classical radiological feature, doctor? String sign of Cantor is considered to be the radiological sign par excellence of Crohn's disease. So this is typically that cicatrized transmural inflammation leading to cicatrization, fistulas, etc. that you see in the case of the Crohn's disease will lead to the string sign of Cantor is what you need to remember. Metaphyses become very dense. So the dense metaphyseal bands, where do we see? In hypervitaminosis D, you see a dense metaphyseal band is what you have to basically remember. So this is a classical question. So what do you use in radiotherapy? We use I-131, cobalt-60, iridium-192, then iodine 125, all these things they are used very much in radiotherapy. Once more, diagnostic, what do you use? Therapeutic, what do you use among the radionuclides? I-129 is diagnostic, 131 is therapeutic. Thumbprint sign, where do you see that? Typically, whenever there is any epiglottitis, that swollen epiglottis look like, the thumb sign is what you need to remember. Superior rib notching. What are all the causes of superior rib notching? The most important cause you need to remember would be hyperparathyroidism, poliomyelitis, Marfan syndrome. Any of them can lead to development of superior rib notching is what you need to remember. So, any abnormal osteoclastic activity like hyperparathyroidism, neurofibromatosis type 1, restrictive lung disease, poliomyelitis, Marfan syndrome, any of them, there can be a superior rib notching. Whereas coarctation of aorta with a lot of collaterals, it is an inferior rib notching. So, एक football ले लो और याद रखना what are the causes of superior rib notching. Eggshell calcification. Eggshell calcification. Where do you see? All of us know it is sarcoidosis, but you should also remember silicosis, pneumoconiosis, and lymphoma, which occur after radiation therapy. They're all the classical examples of eggshell calcification. So, Doc, this is an example of how a eggshell calcification typically looks like. Yes. So you have this PPT made available in the onlinembbs.com video library. Also, Incus quiz app is the modern buzzword. Please don't forget to download Incus quiz app, and you can play morning 8 a.m. to night 12:30 p.m. There is hourly quiz tournament. Every hour there is a quiz tournament. You need to register beforehand, and at least 10 seconds before the quiz starts, you need to be there in the room, and then you need to play, right? So you'll be knowing hour to hour how your preparation is progressing. Morning 8 a.m. it starts with anatomy, 9 a.m. physiology, biochemistry, microbiology, pharmacology, pathology, like that every hour. Starting from 8 p.m., it is 30 minutes. Every 30 minutes you have a quiz tournament. So totally 20 quiz tournaments. So by participating in these quiz tournaments concurrently along with the other classmates, you will be knowing how good you are answering, how much you are getting ready. In comparison to your other competitors, how are you fighting? So they are most important when you are going for the exam. पढ़ना एक चीज है, हमारा पढ़ाई कैसे चल रहा है, जांच करना, that is very important. Okay, so what are the radiological features of mitral stenosis? Typically in mitral stenosis, the left atrium is undergoing enlargement. So left atrial enlargement does not expand the left border, rather it expands towards the right border. So that leads to two borders. That's called border within border. Border within border appearance is what you need to remember. So that gives a double contour to the right heart border. There's a straightening of the left heart border because pulmonary artery hypertension will be there. So that is the reason there's a straightening of left border. There's a splaying of the carinal angle. So typically left atrium is more posterior, right atrium is more anterior. So when left atrium enlarges, that will make the trachea splaying to occur. Carinal angle will undergo splaying. And because of the pulmonary hypertension, there is a pulmonary venous congestion leading to curly lines is what you need to remember. So the left atrial enlargement lead to straightening of the left heart border, evidence of mitral calcification, curly V lines, and a double contour because the left atrium enlarges towards right, and already the right heart border together will form double contour is what you need to remember. So once more you can see this is the left atrium and this is the right atrium. This is called border within the border appearance is what you need to remember. You can also see the left atrial appendage which is projecting. These are the sternotomy wires because this patient of mitral stenosis has earlier undergone mitral valvuloplasty. And you can see mitral valve process, in fact valve replacement. So these are all the features you are able to see. Now doctor, meningioma. If you do plain radiography, what does meningioma reveal? There is a calcification, osteosclerosis, vascular erosion. So these are all the features of meningioma. Meningioma is one of the tumors that shows the presence of the psammoma bodies, calcification, degeneration, etc., etc. Osteosclerosis, any vascular erosions, they're all possible with meningioma. So this is how you can see the presence of the meningioma leading to the erosion. High brachytherapy, what do you use, doc? We use iridium 92, cobalt 60 in case of high brachytherapy. Once more, in the online mbbs.com video library, many times we have discussed about the brachytherapy. Yeah, radiotherapy, what are the radionuclides, everything in the earlier question bank discussion, we have a lot of videos for you to do the revision. Snowman appearance, where do we see? Whenever there is any total anomalous pulmonary venous congestion, then the pulmonary vein, instead of draining into the left atrium will be draining into the right atrium, and because of that, there is a figure of 8 appearance, otherwise called snowman's appearance, is what you need to remember. So where do you see curly V lines, as we discussed in mitral stenosis? Even interstitial edema, lymphangitis, carcinomatosis, any of them can lead to development of curly V lines. Agon side appearance, where do you see? So obviously when the heart is globular and the great vessels have thinned down into a shrink, that typically happen with transposition of great arteries, then the vascular pedicle become narrow, the heart has become globular like an egg. That is the reason it is called agon string appearance, is what we need to remember. So which part of the cell cycle is considered to be most sensitive to radiation? You should remember, yes, you should remember that the various phases of the cell cycle, of all the phases, it is the M phase, G2 phase is considered to be the one which is most sensitive to the radiation. If you do intravenous pyelography in polycystic kidney disease, what does it show? There is something called spider leg appearance. Because the pelvic calyceal structure is all distorted, it looks like the spider leg in case of polycystic kidney disease, is what you need to remember. With regard to chest radiograph, so everything about chest radiography you have to be quite sure. Out of the total lung tissue, 40% of the lung tissue is obscured by bony structure and mediastinum. Obviously, there is liver below the right dome. That's the reason right dome is at a higher level than the left dome. And the right dome, it is due to this liver that it projects up higher compared to that of the left dome. Now, what is wrong about half-life of radioisotopes? So 226 radium has 1626 years, and cobalt 60 5.26 years. They both are true. So all half-lives का एक डिब्बा है table, that बट्टी भरना पड़ेगा आप. You have to mug it up, write it in your hot notes that you need to revise. So what does radium emit? It emits alpha rays, beta rays, gamma rays, and neutrons, all of them. So you should know what are alpha emitters, beta emitters, gamma emitters, alpha and beta emitters. So that is very important, doctor. So this is what I am trying to re-emphasize for you. अगर एक फुटवा लेना है तो ले लो, सारे बुक्स में अवेलेबल हैं. Thorium is alpha gamma, plutonium is alpha gamma, radon 222 is alpha gamma, 3.8 days in the half-life. Whereas cesium is beta and gamma, 2.1 years. I-131 used in radiotherapy, beta gamma, it has got 8 days. So this is the what type of radiation and what is the half-life is the favorite area of examiner. The left-sided cardiac bulge, which you see in case of X-ray, what is it because of? So it is the enlargement of the left atrial appendage, which can happen in mitral regurgitation and stenosis, will lead to enlargement of left cardiac bulge. Figure of 8, just before we discussed, is in the case of the total anomalous pulmonary venous circulation. If you want to diagnose the inflammation, spondyloarthropathy, ankylosing spondylitis, what is the earliest investigation is a very important question. So it is the MRI stir sequence is considered to be the earliest investigation for the diagnosis of ankylosing spondylitis. So you can see on the stir image, in a very early stage, you can be able to see the presence of the signs of inflammation in case of ankylosing spondylitis. For the renal stone, how do you make diagnosis? Yes. For the renal stone, how do you make diagnosis? So you should remember that we use IV pyrography. So we use IV pyrography and ultrasound, very common investigation, basically to rule out the renal stone, and CT, they're all used. So what is one becquerel is equal to? It is equal to, you should know, 1 curie is equal to 3.7 into 10 to the power of 10 disintegrations per second, or becquerel. So the SI unit is basically becquerel. So becquerel, 1 becquerel is equal to 1 radioactive decay per second, which is equivalent to 2.703 into 10 to the power of minus 11 curie is what you have to remember, the conversion factor, which is the favorite question of the examiner. Now, in metastatic bone pain, whenever metastases are there, to manage those bone pain, what isotope can be used to relieve? Strontium I-131, P32, rhenium, they all have a good affinity for the bone, hence use it for treating the metastatic bone pain. Teardrop bladder, where do we see? Whenever there is any pelvic hematoma or a pelvic lipometasis. So this is a pelvic hematoma leading to teardrop appearance of the bladder is what you have to remember. So the low dose radiation, what does it lead to? As we said, leukemia is most common, even lung cancer, glioma, meningioma, any of them can occur because of the low dose radiation. So you should know what are the radiation induced malignancies you need to be very sure about. The left heart border of the chest X-ray, it is basically formed by aortic arch, left pulmonary artery, and the left ventricle. So obviously, whenever hypertension is there, so the aortic arch become bulged out. That's called unfolding of aorta, because aorta forms the left border of the heart. Below that, you have the left pulmonary artery. Whenever pulmonary hypertension is there, that leads to straightening of the left heart border and the left ventricle. So they constitute the left border of the heart is what you need to remember. In external beam radiotherapy, What radionucleotides do we use? We use cobalt 60, cesium 137, iridium 192. So you should know in brachytherapy and EBRT, what are the specific nucleotides which are being used is a favorite question of the examiner. So how do you do virtual colonoscopy? So virtual colonoscopy, it provides endoluminal view. We use CT and MRI. Whenever the conventional colonoscopy fails to detect, then you can do the virtual colonoscopy. And it's also used for screening for the carcinoma colon when the person is not ready to really undergo the colonoscopy. Bare orbit, where do we see? Whenever metastases are there is a cavitating osteolytic lesions, which is called bare orbit when metastases are there. So this is also called bare orbit sign from a CT scanogram. You can see here in the left wing of the sphenoid bone. So high energy accelerator, whenever you are using, what does it basically produce? It produces the X-rays. Then the final question for today's evening. I'm so happy to be reconnected with all of you. And every day we will all meet in the evening. We will have 50 to 60 questions discussed, get ourselves inspired to prepare. And everything, when you say knowledge bank, for you to do the revision, mock tests, everything is there in the onlinemmbbs.com. And if you want to play quiz tournaments every hour across the day, please don't forget, download Incus quiz app in the Google Play Store. You have the link below. And across the day, you have friends available to fight with you, and you can know how good you are scoring. Every hourly quiz is there from 8 a.m. to night 12:30 p.m. And even if you miss a particular quiz, you can still play autoplay, and it will compare with the earlier players' player history. It will compare your performance, right? So don't forget to download today and also share with your friends. In a couple of days, we will also come with Apple App Store. Also, it will come. Right now, we are on the Google Play Store. So electromagnetic radiation. Infrared is a electromagnetic radiation. Quantum scattering occurs for the intermediate energy. X-ray is the electromagnetic radiation. So you have to be very sure about. So doc, that brings us to the end of today's evening. Another 75 days, we will work together every day, studying every day. Every Sunday, we will have a full-scale grand test and discussion, and then inspire ourselves to do revision, get hold of all the high-yield topics, high-yield facts. After all, winning entrance exam is not a rocket science. It's very easy, achievable, provided you have the focus, you know what to read. There is a list of 953 topics that I mentioned in the onlinemmbbs.com, which you can do the revision, right? Only thing is you need to give your time, at least 200 hours. Do we have in the next 75 days 200 hours? Very much, more than that. So definitely achievable even if you start today. Good luck, and once more, we will all catch up. Please don't forget to subscribe to this YouTube channel so that when we start a session, suddenly in the midnight, you will get a notification. There's a bell sign, please click on that. Good evening and have a great time. Thank you.